Veins can differentiate based on a person's genetics, and not all veins are the same. Some are normal or hyperelastic, some may be weak, wide, or narrow, and some are superficial or deep. This is why vein finders are such an innovative medical device, designed to enhance the visibility of veins beneath the skin, making it easier for healthcare professionals to locate veins for procedures such as IV placements and blood draws. The vein viewer or finder is a real-time projection of a person's veins. Another enhancement in precision medicine is digital twinning. Digital twinning is the process of creating a virtual twin for a physical object, system, or process. This can be used in healthcare by creating a more precise, personalized, and caring treatment plan by collecting data from the patient. In the PEDS unit, some cases will require a full-time monitoring of the patient, and digital twinning can assist in this by monitoring the patient for you and be able to send an alert when something seems off, maybe even faster than you can discover. Digital twinning is important in healthcare in the fact that new technology is creating a continuous update with real-world data on individual patients. According to healthtech.gov, the creation of a digital twin requires data, whether that's from sensors, scans, medical records, insurance records, or other statistically relevant data sets. It may also rely on high-quality 3D images and animations to accurately represent physical systems. AWS LOT Twin Maker gives medical companies an environment to combine datasets and 3D images to create operational twins quickly. 2 points do not make a trend. 1,000,000 points may not either. It is so important to have big, robust datasets that we can analyze. He says, also adding that these datasets can be used to train AI models to create more accurate simulations. This article also states that they strive to see unique applications, such as having digital twin of an embedded or wearable medical device, such as an insulin pump or pacemaker. A digital twin could help understand the device's current state for better monitoring and management. Digital twins could also be used to model the home environments of older adults to learn how to keep them in their homes longer. The more we push the boundaries and have truly operational twins overlaid on the design twin than we can run simulations on, I think we'll be able to engineer a full test in a completely virtual environment before we ever test in a physical environment. They also go to state that changing the way we think about how design and test products. Over time, he says that digital twins can help the healthcare industry engineer better products more quickly and with more efficient stress testing. The article goes on to state how since technology is constantly changing, it will be really interesting to me to see where it leads in the medical field 5 to 10 years from now. One thing digital twinning will eventually be able to discover at a faster rate is biomarkers. Similar to genes, biomarkers are biological molecules that can be found in tissues, blood, and other body fluids that signal an abnormal process or condition of a disease. Biomarkers basically can tell how the body is doing. This is critical in investigating effective drugs in people. This is most commonly integrated with scanning technologies like PET and MRI scans. Biomarker testing is most commonly used to detect different types of cancers and diseases. Biomarker testing amongst pediatrics is insanely important because children tend to get sick way more than an adult will in their lifetime. Children are far more resilient and are able to bounce back faster, which is why biomarkers are cool, because they can detect an abnormality in the body before a child starts experiencing symptoms with a diagnosis. Digital biomarkers are designed in wearable sensors and smartphone technology. The constant digital monitoring can identify different diagnostic, prognostic, and predictive biomarkers before they grow and become untreatable. The next piece of precision medicine I find interesting is 3D and 4D scanning. Better than traditional 2D scanning, 3D and 4D scanning are more accurate, allowing clinicians to view every angle. 3D and 4D imaging are transforming how we see and understand the world. 3D imaging creates detailed, three-dimensional pictures of objects, helping doctors, engineers, and scientists view things from all angles. 4D imaging goes a step further by adding the element of time, capturing movement in real time. This means we can see how things change and move, like a beating heart or a baby's development in the womb. These technologies are making diagnosis more accurate, improving treatments, and even helping in fields like engineering and entertainment. Nanotechnology is the science of working with very tiny atoms and molecules. It involves creating and using materials and devices that are incredibly small, which can lead to big advancements in medicine, electronics, and other fields. For example, it can help make better medicines that target specific cells in the body or create smaller and more powerful electronic devices. One thing I have found interesting is a targeted drug delivery system. This is how it sounds, where nanoparticles are delivered through a shot, going directly to the cells to fight off different infections or diseases. AI is growing rapidly, especially in the use of databases, algorithms, and more personalized treatment plans. In addition to this, it will create a more powerful healthcare system while providing information at a faster rate. Other technologies that I'll briefly mention are wearable technology, robotic surgery, and AI use in drug discovery. Wearable health technology can range from smartwatches, blood pressure monitors, glucose monitors, and fitness trackers. Robotic surgery, which allows for more precision and accuracy. Obviously, children are much smaller than adults, so this innovation will limit the amount of disruption when they need to go into surgery. One of the concerns in all of this technology is the affordability for the use of it. For example, the robotic surgery I mentioned earlier has a product called the Da Vinci Surgical System, which was first discovered in Europe in 1999, but was not permitted in the US until the 2000s. Each time this product is used in surgery, millions of dollars are being spent. Annually, $190,000 is spent on maintenance in addition to disposables and consumables, which can range from $800 to $3,500 per surgery. Other factors of expenses include hospital care, prescription drugs, chronic disease, and administrative costs. These innovations are almost unheard of being actually used because they are so expensive to recreate and use. Hopefully in the future, more healthcare can become more affordable and easily accessible. In conclusion, the future of healthcare promises to revolutionize the way we diagnose, monitor, and treat diseases. With advancements in artificial intelligence, high-resolution imaging, real-time data analysis, and personalized imaging plans, we are on the brink of a new era in medical technology. These innovations will not only enhance the accuracy and efficiency of healthcare, but also ensure safer and more patient-oriented approaches. As we embrace these cutting-edge technologies, we pave the way for a healthier world, where early detection and preventative care become the normal, ultimately improving the quality of life for all. Together, let's look forward to a future where healthcare scanning transforms lives and brings hope to millions. If any of you would like to look further into these technologies in healthcare, please leave a comment below and I will send out the sources. Thank you guys so much for listening.